Hi everyone, Dr. Andi here. It is 2 o'clock and it is time for our Facebook Live. I will be answering all of your keto questions today, or I will be trying to. I'll get to as many as I can. While we are waiting for people to log on, I'll give you a brief introduction about me and my background. So I've been with Prove It from the very beginning. I'm a naturopathic physician. I'm practicing in Toronto. I've been practicing for almost 10 years now, and I had a foundation in sports medicine and slowly moved more towards a hormonal focus. But at the foundation of my practice has always been a ketogenic diet and a low-carb diet. We work with over 15 practitioners here in our clinic, and all of us have the same keto low-carb focus. So that really is a foundation for a lot of our protocols and our treatment protocols. So again, as I mentioned, we see a lot of hormones, a lot of specialty in ketogenic diet. So that's my focus. I personally have been keto for almost 15 years now, moving in and out of ketosis. Sometimes I'll come out, but always low carb and high fat, which I know has always been a bit of a challenge for some people to wrap their head around, given we've entered the low carb or the low fat, no fat trend. So thankfully that's slowly starting to turn itself around. So hi everyone, I'll give you all a chance to log on, and I'm looking forward to answering all of your questions. As I mentioned, I try and get to as many as I can, and I will scroll through a little bit later and answer some if I don't get to them all. So feel free to just repeat them. So I'll start answering as we go. So somebody was asking, how long do you stay in ketosis? So that's a really great question, and I'm assuming you mean, I don't know if that meant me personally or if you meant when you take an exogenous ketone, so I'll answer both of those questions for you. So taking exogenous ketones, they can stay in your system from anywhere from 2 to about 5 or 6 hours even, just depends on how quickly your body makes use of them. The more that your system needs them, the faster they'll be used. But the great thing about ketones is that they're water soluble, so you can't accumulate ketones. If your body doesn't need them, they will just be eliminated via the urine. They won't be stored as fat, which is not the case for glucose. So some questions about ketones and fibromyalgia. I do love that question. Again, I always like to start by saying that ketones really won't cure or treat any medical condition. We're not making any medical claims. But from the standpoint of fibromyalgia, what we often see with fibromyalgia is an underlying inflammatory picture. Often people will say that there's no cause to fibromyalgia and chronic fatigue, but what we often see as the underlying cause of that is a severe stress. So most often people have a very stressful event or some kind of viral infection that preceded the onset of those symptoms. And so what we're looking at is that underlying inflammation. So when I see someone with chronic fatigue or fibromyalgia, I'm looking to really try and treat the underlying inflammation. So is there a role for ketones there? Well, we know the anti-inflammatory benefits of beta-hydroxybutyrate. We know that it can impact those inflammatory cascades and decrease the release of some of those inflammatory markers. And again, when I say inflammation, it's not inflammation, I hit my wrist and it's swelling. It's systemic inflammation that we can't see that can be caused by infection, stress, poor lifestyle choices. So from a fibromyalgia standpoint, there is potential to see benefit there from the anti-inflammatory component, and also from the energy component, because there's a large degree of fatigue that goes along with that condition, so you might see benefit from an energy standpoint as well. Somebody was asking a question about eczema. That kind of ties into what I was just talking about. Eczema is often very much an inflammatory picture. So when we're treating eczema, we also want to treat the underlying inflammation. So there may be benefit from managing some of that underlying inflammatory component as well. And I also like to make a lot of dietary changes with eczema. Definitely taking out dairy, getting the grains out. You do see a lot of benefit if you can make some of those changes. So anxiety and depression. I do love that. Actually, I'm going to touch on, I just saw lupus and inflammation. So yes, so essentially that's more of an autoimmune. So really when we're looking at autoimmune conditions, overall, there is an underlying inflammatory picture that we do want to address. So we do want to treat anything that might have triggered that autoimmune, but we do see the same sort of stressful event, viral infections that often precede the onset of autoimmune conditions. So one of the primary things we want to do is manage that underlying inflammatory picture. So you may see benefit from the anti-inflammatory properties of the ketones. So so somebody was mentioned anxiety and depression, and I do love that topic as well, since anxiety and depression are really so prevalent nowadays in really all age ranges. So what the research is showing is that beta-hydroxybutyrate actually encourages the production of GABA. GABA is a very calming neurotransmitter, and changes or defects in GABA and also in serotonin have been linked to anxiety and depression. So that's often something I'll use in it from a treatment standpoint in anxiety is often oral GABA supplements. So the beta-hydroxybutyrate has been shown to encourage the production of GABA, which is a very calming neurotransmitter. So you may see benefit there from the potential impact on the neurotransmitters. We often get questions about calming, or the calm sensation people feel, or the improved sleep that people get, and that could also be to the impact on the nervous system that we're getting, and again from that the potential impact on GABA. So that kind of ties in. Somebody mentioned Parkinson's a little bit earlier, so that ties into that a little bit as well. We do know that the neurological aspect or benefits of ketones is really where the ketogenic diet started. It was found in treating epilepsy, or children who suffered from epilepsy, and helped to manage their seizures. And then the research stemmed from there, looking at the neurological benefit. And what some of the studies show is that there may be a potential neuroinflammatory impact that it has, so it brings down neuroinflammation. And there's even some research that suggests neuroregeneration. So there could be benefit there. Again, if you do suffer from a medical condition, you do have to make sure that it's okay and your healthcare provider has approved the use of the ketones in conjunction with everything else that you're taking, but you may see benefit from that neurological standpoint. So the question on PCOS, I do always love the hormone questions. So I do a lot of hormonal balance in men and in women, and so obviously I do treat a lot of PCOS in practice as well. And what we often see in PCOS, and I'll tie this in because I saw some questions earlier about diabetes, so I'll sort of tie these answers in together. What we see with PCOS are changes in hormonal balance. So we'll see women who have high androgens or male sex hormones. We also see women who are more prone to type 2 diabetes, metabolic syndrome, they have insulin resistance. So we do know from a research standpoint that beta-hydroxybutyrate has been shown to improve insulin sensitivity, manage blood glucose levels. There could be benefit from if they're suffering from type 2 diabetes, and some of the research also does show that in women with PCOS that supplementation with beta-hydroxybutyrate or BHB actually helps to modulate or even decrease some of those androgens in the male sex hormones. So there could be potential for women suffering from PCOS. And in animal studies, we also know that women often have irregular cycles or they don't ovulate. And in some of the studies looking at beta-hydroxybutyrate and PCOS, they showed that it encouraged ovulation. And that was in an animal study. So more research would need to be done in that space, but there could be some really good potential benefit there. And so tying that into the question on diabetes, and I see a type 1 diabetic question as well. So tying that into the question on diabetes, is it safe for diabetics to take? And again, you have to get approval from your healthcare provider. You do need approval from your healthcare provider to ensure that it's safe for you, but we do see potential benefit because the ketones, the ketogenic diet, and the BHB have been shown to improve insulin sensitivity, decrease blood glucose levels, which would be beneficial for a type 2 diabetic. And for a type 1 diabetic, what I generally suggest is you need to make sure that you're a controlled diabetic. The concern is diabetic ketoacidosis. This is not possible as long as you have insulin in your system, and the insulin kind of controls that feedback loop, and so it makes sure that you're not going to produce too many ketones. So the problem in type 1 diabetics is they're not making insulin. So you have to make sure that you're controlled diabetic, and I do suggest and encourage monitoring your blood glucose and your blood ketone levels equally, just to make sure you're staying in that right range, in the correct range. I saw a question on stroke as well, and I've had that question a few times. There is some research looking at coronary artery disease, ischemia, stroke, and some interesting research is showing that administration of oral supplementation, again, this is of oral beta-hydroxybutyrate, and these were animal studies as well. If you can supplementation with beta-hydroxybutyrate immediately after a stroke can actually prevent some of the negative outcomes that are suffered from, or that individuals experience after they've suffered from a stroke. So there could be some benefit there. Again, you have to work with your healthcare provider to make sure it's safe, especially immediately following a stroke. But there is some really interesting research there. So that ties in a little bit to the blood pressure and the heart rate question. So again, the ketones actually have been shown to improve those metabolic markers and the cardiometabolic markers. So blood pressure, also looking at things like lipids, triglycerides, LDL, so that bad cholesterol. So studies have shown that there is a beneficial impact from a ketogenic diet and the beta-hydroxybutyrate on those markers. There shouldn't be an increase in blood pressure. If somebody is experiencing that, then what I would suggest is to make sure you're not taking the caffeinated version, or to make sure that you reduce your dose or reduce your serving. Maybe start with a quarter serving, allow your body to adapt a little bit. And so say for Crohn's disease, I like this. So I'm going to move into digestion a little bit. So someone is asking about Crohn's. So I get the question about Crohn's and colitis quite a bit. And sorry, I'm seeing a cholesterol question. That ties into what I just answered as well. So we are seeing positive impacts on cholesterol. Some people have said that when they start a ketogenic diet, they do see an increase in their cholesterol. I generally suggest that you don't check your cholesterol for about give yourself 3 to 6 months. Allow your body to adjust to the new dietary changes, and then make sure that you're following with your healthcare provider as well, and then recheck your blood work. But there is a positive benefit to the research shows there could be positive benefit on the cholesterol levels. So work with your healthcare provider and give yourself some time. So moving back to the digestion question with the Crohn's disease and also colitis I get quite often, there is some really great research linking beta-hydroxybutyrate and the beneficial impact it has on the gut. So beta-hydroxybutyrate has been shown to encourage the healthy production of good bacteria in the gut. And we know that the gut microbiome is essential. There's also an anti-inflammatory component to the ketones, which have been shown to be beneficial in inflammatory bowel diseases. So there could be benefit there from the inflammatory or the anti-inflammatory properties, and also the potential modifications in your gut microbiome. So some people will also say that they'll experience a little bit of gut disruption or digestive distress when they first take it. If that's the case, just reduce your serving. And then slowly move up to the full serving from there. You've got lots of great questions. Sorry guys, I know I'm missing tons of them. So what happens when you have glucose and ketones? So great question, for sure. And that often happens when someone takes ketones and they're not changing their diet. So the interesting thing is that the body will choose which fuel it wants. So there are certain organs that actually prefer glucose, such as the kidney, the heart, the brain, that prefer ketones, kidney, heart, brain. So the organs actually know which fuel source it wants. So when presented with both, it'll pick the one that it wants to use in order to get the greatest benefit. And Jacob and Ryan, if you're at one of the events, they also presented on this and showed that muscle, for example, will preferentially choose ketones over glucose. And I believe that they're in the process of publishing that study, so hopefully that will be available soon. And the good thing about ketones is if your body doesn't make use of them, because they're water soluble and not stored, they will be eliminated via the urine. And there is that dual benefit of ketones actually helping to improve insulin sensitivity and decreasing blood glucose levels, so it does get the glucose out of the blood. So the question is, does it harm, I've seen too if ketones will harm thyroid and your adrenals, and the answer to that is no, there should be no harm to your adrenal glands or any harm to your thyroid. There have been beneficial impacts on hormones overall, and thyroid autoimmune, again, as I mentioned a little bit earlier, and looking at the underlying inflammatory picture in autoimmune disease, there could be potential benefit there as well. But no, we're not seeing, and we haven't seen in the research yet, that the beta-hydroxybutyrate would cause harm to your thyroid or harm to your adrenal gland. So we're having some questions about cancer. So actually, and I'm going to tie on the IBS question. So yes, I was talking about Crohn's and colitis. Yes, there could also be additional benefit in IBS. So I would kind of tie those into the same area. So the question is, if we're in nutritional ketosis, will it hinder your weight loss if you take nutritional ketone or exogenous ketones? And the answer is actually no. And so some people have asked, what is the benefit if I'm already in nutritional ketosis? Why do I want to take exogenous ketones? And when we look at, and again, it was Jacob and I did this study last year looking at just taking exogenous ketones, taking exogenous ketones with the normal diet, exogenous ketones, and a ketogenic diet. And you get the greatest benefit when you pair exogenous ketones with a ketogenic diet. That actually optimizes and enhances your results. So no, it's not going to hinder your results. It's not going to hinder your weight loss. It will actually optimize the results that you're looking for. So we're talking about cancer. I've seen a few cancer questions, and I don't talk a lot about cancer and ketones. So what I would say is I would direct you to the research of Dr. Dom and Dr. D'Agostino, or Dr. Dom and Dr. Angela Poff, and their research focuses on the role of ketones and cancer. And there is a lot of really great evidence that is slowly emerging showing that there could be benefit from a ketogenic diet and from exogenous ketones when it comes to cancer. And they're also doing some research looking at radiation or chemotherapy, so the treatment and the potential to work in conjunction with your current treatment. So again, I'm not saying we don't make any medical claims, don't make any medical claims at all. I'm not going to say it's a therapeutic option for you in cancer, but definitely worth looking at the research, presenting it to your oncologist, and seeing if it might be an option for you. So I saw another question, gallbladder. So talking about gallbladder, when we talk about the gallbladder, people get a little bit concerned about the ketogenic diet and a higher fat diet, because people who have had their gallbladder removed often have problems digesting fat. So exogenous ketones will not impact your gallbladder. If you've had your gallbladder removed, you shouldn't have any issue taking exogenous ketones. Even following a ketogenic diet should be fine. What I often suggest if you've had your gallbladder removed is to just make sure you're taking a digestive enzyme that contains something called ox bile, and that will help with the fat digestion. But overall, again, speak with your healthcare provider, but overall you should be okay. And talking about kidney stones, I get a lot of questions on kidney stones and gout. Since there have been, from the ketogenic diet standpoint, there have been some links with the development of kidney stones. And usually, in my experience as well, I see that that's due to an imbalance in minerals. We know that the ketogenic diet can act as a bit of a diuretic. So either way, I'm always asking people to make sure that they're getting their electrolytes, you're getting your magnesium, to make sure those minerals are balanced. But from a kidney stone standpoint, taking a potassium supplement will really reduce the risk of developing kidney stones if you're following a ketogenic diet. We haven't seen evidence to suggest that exogenous ketones will have that same link, but if you are concerned, then I would suggest just adding potassium supplementation into your diet. And the question about UTIs, so no, I don't see a link or an increased occurrence of urinary tract infections on a ketogenic diet or when you're taking exogenous ketones. So we don't see that link as well. I've had a few more questions on lupus and RA. So again, these are autoimmune conditions that I touched on a little bit earlier. And also I'm seeing a few more and I'm seeing a few more on thyroid. So again, it's the anti-inflammatory component where you may see benefit. So beta-hydroxybutyrate has been shown to impact that inflammatory cascade and actually inhibit the production of certain inflammatory molecules. So you may see benefit from autoimmune conditions because the underlying component of autoimmune is most often inflammation. So we're wanting to target that inflammatory component to try and help manage that autoimmune picture. So it's usually an underlying inflammatory picture. So a question was, which magnesium do I prefer? I usually prefer magnesium glycinate. Bisglycinate is usually the magnesium that I use most often. That way you still get the effect, but you don't get the gastric impact that a lot of people experience. I did see a question about mucus in the stool, and if that's a common occurrence on the ketogenic diet. The answer to that is no. Mucus in the stool is not a common occurrence from a ketogenic diet. If you are experiencing mucus in your stool, you do need to go and get that investigated. We'll often see that in inflammatory bowel conditions, leaky gut. So you do want to get that checked out and make sure that there's nothing else going on and that you have optimal gut health. So no, that's not a common outcome from the ketogenic diet or exogenous ketones. So definitely get that checked out. So autism. So we get a lot of questions about autism, ADHD, and so there's a lot of great research. I like to point people to the Charlie Foundation. They have a lot of great information on autism and ADHD. And what we're noticing is that children who exhibit autistic behaviors and children with ADHD have similar brain waves to children with epilepsy. And we know that the ketogenic diet has been beneficial in controlling seizures in children with epilepsy because of that calming impact on the nervous system. And so research is suggesting that this is why we see behavioral changes in children with ADHD and autism when they do begin to follow a ketogenic diet, or when they, and so there is potential with taking exogenous ketones of mimicking that same effect. Again, work with your doctor and make sure it's safe. But yes, there is evidence to suggest that there could be benefit there. So, question about fatty liver. So are ketones safe for fatty liver? So the answer to that is yes. There's a common misconception where when you have fatty liver, people are told to have or to follow a low-fat diet. The cause of fatty liver is not high fat, it's actually high sugar in your diet. So that's a bit of a misconception. If you do have fatty liver, you want to cut the sugar out of your diet. So ketones have not been shown, and exogenous ketones have not been shown to be detrimental to the health of the kidney or the liver, and actually quite the contrary. They've been shown to show, research is showing that they actually have benefit in supporting the health of those organs. So again, with fatty liver, I would cut out the sugar, work with your healthcare provider for sure, make sure it's safe for you, but I'd cut out the sugar, and there's no evidence to suggest that the ketones would be detrimental to the health of the liver. So I'm getting a lot of dietary questions as well. So someone is asking, is the paleo diet a good option? Yes, that's a great option as well. Paleo diet cuts out all the grains, so you really are substantially decreasing a lot of that carbohydrate consumption. So paleo diet is great. The only thing I have with the paleo diet is it can still often be high in sugar because there's no limitation on the amount of fruit you consume or anything like that. So all I say is just be aware of the sugar consumption in your diet. And again, sugar, even if it's healthy sugar, it's still sugar. So just be aware of the extra sugar consumption in the diet. But yes, absolutely, paleo can definitely be a really great choice. Can be a great choice if you are taking exogenous ketones. So I'm getting a lot of diabetic and Parkinson questions. So I answered a little bit earlier. So the Parkinsons absolutely do that impact on the nervous system. There is a lot of research in that space. So working with your neurologist, I think that could be potential benefit for you because of the impact it has on neuroinflammation and the potential even neuroregeneration. So there are a lot of neurological disorders that could potentially benefit, but the research is slowly emerging from the exogenous ketone standpoint in this space, but there's a lot of research looking at the ketogenic diet and beta-hydroxybutyrate. So I would say absolutely it could be beneficial. So work with your neurologist if you're considering adding that in. I see questions on testosterone, so more hormone questions. And so we get a lot of great, I get a lot of great results on hormones and testosterone. And so the ketogenic diet is pretty much the first thing I'm giving to my patients when I'm trying to balance hormones. And I mentioned a little bit earlier that in women who are suffering from PCOS, the ketogenic diet and exogenous ketones actually help to lower the androgen, the male sex hormones. But the interesting thing is that in men, it's the reverse. So we don't see men on a ketogenic diet who have substantially lower testosterone levels. And in fact, it's quite the reverse. When you switch men to a low-fat, high-carbohydrate diet, that's where their testosterone levels go down. And then reverting them back to a high-fat, low-carb diet can partially restore those levels. So men do need the higher fat diet to maintain healthy testosterone levels. So I do always encourage the ketogenic diet. I do always encourage the ketogenic diet when it comes to hormonal balance. And intermittent fasting is also a great option there as well. That's a great way to boost testosterone in men. So I also often encourage the intermittent fasting of overnight, so about 16 hours. So from dinner to your first meal the next day at a 16-hour interval. And there's a lot of benefit has been shown on testosterone levels in men that way as well. So we are getting lots of autoimmune questions today. So I touched on that a few times, but I will answer that again. So I touched on that a little bit earlier. So the autoimmune component, people always assume that there's no known cause, no known, we don't really know why you have it. And what I often see is that what happens before autoimmune is a really stressful event or a viral infection. So something that leads to a large stressor on the body. And we see a lot of underlying inflammation in autoimmune conditions. So I'm seeing again, Hashimoto's. I'm seeing a lot of questions on fibromyalgia, a lot of repeated questions on just sort of a lot of autoimmune questions coming up actually. So again, with all autoimmune conditions, the underlying component that we're trying to address is inflammation. And we know there's an anti-inflammatory benefit to beta-hydroxybutyrate, so there could be potential benefit for you from an autoimmune standpoint due to the anti-inflammatory benefits of beta-hydroxybutyrate. So again, work with your healthcare provider, but there could be benefit there. So somebody is asking about hair loss with a ketogenic diet, and I get that question quite often. And generally, if that's what's happening, it's usually because someone has missed something, or the ketogenic diet isn't being followed quite in the right way. So for example, someone who thinks they're on a keto diet and all they're eating is, chicken and lettuce, for example, but they're not getting those healthy fats. When you restrict the carbohydrates, you need to make sure you're getting those fats, and that's what ensures hormonal balance. So the only time I see hair loss or something like that is if they're not doing it properly and they're not getting those healthy fats in their diet. You also want to look at your minerals. You want to make sure you're not losing minerals that are essential in the body, so make sure your minerals are there. And then you have to look at other things that contribute to hair loss, like thyroid imbalance, iron, low iron, if you're in menopause, the changes in your estrogen level. All of these things contribute to hair loss. So you've got to make sure that you've looked and managed all of the other things that are going on before you say that it's a diet that has caused that as well. So if you're doing it properly and you're still experiencing hair loss, then you've got to start looking at those things. So hormones, estrogen, thyroid, iron, B12 levels, even your cortisol as well, because all of those things can contribute. So I'm getting a lot of questions on blood thinners. I've seen some Coumadin questions coming through. So I do get that question a lot. If you can take ketones while you're on a blood thinner, you have to work with your healthcare provider when you're talking about a specific drug that you're taking. I personally can't a certain individual say yes or no. There are a lot of people who are taking medication who do take exogenous ketones. From a ketogenic diet standpoint, again, it could be quite safe, but you have to work with your healthcare provider. I can't say that it's right for you to take, so there are people who are on a ketogenic diet or taking ketones who are on blood thinners, but because that's variable for each person, you've got to work with your healthcare provider to make sure that that's the right choice for you. So another question, I saw some Lyme disease questions. So we do a lot of Lyme disease in our clinic here. That's one of our specialties. We see a lot of Lyme patients, so I'm treating Lyme on a daily basis. And all of my Lyme patients are advised to start a keto diet, and all of my Lyme patients are advised to start exogenous ketones. And that's not to say that a ketogenic will cure Lyme disease. It will not do that at all. But what I want to do is try and help from a symptomatic standpoint. I want to try and help manage the symptoms of Lyme. So, top to bottom from Lyme disease, we see fatigue, brain fog, tremors, and a lot of neurological dysfunction. We see gut dysfunction, joint pain, a lot of underlying inflammation. So there are a lot of things from a symptomatic standpoint that might have, where the ketogenic diet and exogenous ketones may be of benefit. So again, it's not a cure at all. It's not going to cure Lyme disease, but it could help from a symptom management standpoint due to all of the different components of Lyme disease where beta hydroxybutyrate could be of benefit. So absolutely, again, you've got to work with your doctor, but there could be great benefit there as well. So we're getting I'm getting some more cancer questions. So I touched on that a little bit earlier, and there's a lot of research emerging in the field of cancer. I would direct you to the research of Dr. Dominic D'Agostino and Angela Poff. They do a lot of research on ketones and cancer. So there is some really great research that's emerging showing that there could be potential benefit from a cancer standpoint, and also benefit in optimizing treatment or your response to treatment. So there is a lot of research that's being done in this space. I would direct you to their research, Dr. Dom and Dr. Angela Poff. Again, with cancer, you have to work with your oncologist. Prove It and Keto West, we're not saying that we cure or treat cancer in any way, shape, or form, but there is some interesting research coming out in that space. So I would check out their research and talk to your oncologist about that, absolutely. So someone is mentioning leg cramps on a keto diet. So that is usually a mineral deficiency. So if you're getting leg cramps, if you're getting migraines or something like that, often that's a mineral deficiency. Again, ketones can act as a bit of a diuretic. So I would suggest making sure you're getting all of the minerals that you need. Make sure you're getting your magnesium. I like magnesium bisglycinate. A lot of people are deficient in magnesium to start with, so they sort of lose a little bit more, and that's why some of those leg cramps happen or the headaches happen. So get some electrolytes in, get your magnesium in at least 200 milligrams a day, and that is often helpful for the leg cramps, and potassium can be quite helpful there as well. So I'm going to answer one more question I saw a question about about concussions. So I'm going to answer I love that question. There's a lot of great research emerging in the space of traumatic brain injury or TBI and concussion. We know when it comes to brain injury that the brain can't efficiently make use of glucose as a source of fuel. So the brain is starving, but it can make use of ketones. And so there's a lot of research in this space right now looking at the administration of ketones after a concussion to help, to help prevent post-concussion syndrome or to help manage the symptoms of a concussion. So lots of research in that field. I would say absolutely work with your healthcare provider, but there could be some really great potential benefit there from the ketogenic diet and from the exogenous ketones. So someone is asking about kidney pain. So I would say if you're experiencing kidney pain, absolutely consult with your healthcare provider. You shouldn't be experiencing kidney pain when you've changed your diet or if you're taking a supplement. So work with your healthcare provider. Yes, absolutely make sure you're getting all your minerals and electrolytes in, make sure you're getting your potassium, but I would say absolutely check with your healthcare provider. I would say check with your healthcare provider, make sure that there's nothing else going on there. And so the last question is, do ketones affect a woman's cycle? So absolutely it could. We were talking about hormones a little bit earlier. I was talking about women with PCOS and the research showing that, and in animal studies, that beta-hydroxybutyrate can encourage ovulation. There is a positive impact on, again, women with PCOS who have insulin resistance, high androgens or male sex hormones, and there's a component of that is managed with the ketogenic diet, or where there's benefit in bringing those testosterone levels down or helping to improve that insulin sensitivity with the beta-hydroxybutyrate. So all of these things would absolutely impact a woman's cycle. So I do with women who have amenorrhea, that was the question earlier, or who aren't getting a period. Absolutely, I'm introducing dietary modifications, lots of high fat. The fats are essential for hormonal balance. So yes, absolutely, there could be an impact on hormones and a woman's cycle from that standpoint. So the last question I'll answer is about weight loss. So I'm assuming the question is either a weight loss plateau, or will you see the weight loss results that you're looking for? So I like to always say, when it comes to weight loss, I like to start by saying that it's important to remember Keto-S is not a weight loss supplement. That's the first thing. But the reason people see weight loss is as a secondary benefit to the other things that the ketones are doing in the body. So it has an impact on our hunger and satiety hormones, so our hormones leptin and ghrelin. It's been shown to improve insulin sensitivity and decrease blood glucose levels. Studies are suggesting there's a direct impact on appetite, so it can act as a bit of an appetite suppressant. So all of those things overall would show benefit from a weight loss standpoint, and that's why we see weight loss secondary to a ketogenic diet. So those are some of the really great impacts. We also see changes in inflammation, and we know inflammation can impede weight loss. Hormonal imbalance can impede weight loss. So it's the secondary benefits that can show some really great weight loss or really fat loss results from a ketogenic diet. So I think that is all the time I have today, everybody. I hope I answered all of your questions. I know I'm sure I missed a lot of them as I was scrolling through, but hopefully I got to most of them. If not, then I will see you next time and bring all of your questions, and hopefully I'll answer them on the next Facebook Live. Enjoy the rest of your week.